How you doing? It's Sandesh and we're to do a video on an article on Infowars, and this is just absolutely laughable. I mean, first the puberty blockers fiasco, and now this. Anyway, the headline is UK's NHS will now ask men if they are pregnant before X-rays. What the fuck? How the hell are men supposed to be pregnant if they don't have a womb? That is not biologically possible. This is just completely dumb. All about inclusion, but it's like, how the hell are men supposed to be included in pregnancy of being able to have a baby when they don't have a room, when they're not biologically able to do it anyway? Anyway, before I get into the article, this laughable article, well, I don't blame Infowars. It's obviously not their fault. They're just obviously talking about the absurdity of this. If you can follow me on X and subscribe on YouTube, I'm below now to see TikTok and BitChute as well, if you don't mind, please. I'm going to get into it now. The UK's National Health Service has instructed X-ray operators to ask men if they are pregnant before conducting scans, reportedly prompting patients to storm out of appointments in anger over the absurdity of the question. Yeah, exactly. It's fucking absurd. It's just completely stupid. The so-called inclusive guidance was inspired by an incident in which a woman who presented as a man had a CT scan while unknowingly pregnant, thereby exposing her baby to dangerous radiation, the Telegraph reported. However, NHS staff have stressed that the new guidelines pose a risk to the safety of patients by discouraging appointments due to the distress sparked in both men and women by the new appointment questions, which ask for their sex at birth and preferred name and pronouns and make ridiculous claims about people who were born with variations in sex characteristics, according to the Telegraph. What the fuck? One man on an urgent cancer pathway was so annoyed by the questions on the form, he shouted he left the department and didn't actually have a scan, one radiographer told the Telegraph. There is an uncertainty risk for these patients if they do get so annoyed and don't have the scan, said the radiographer. Well, the thing is, what's the point of having asking these sort of questions for? These are the sort of questions about as far as related to pregnancy. You should be asking a woman this, not a man. Women have also reportedly cried over invasive fertility questions, which now prompt for specific reasons behind infertility, triggering traumatic memories of miscarriages and ectopic pregnancies, which are required to cite in background forms. Staff say that patients of both sexes have been insulted or embarrassed by the suggestion that their sex is not necessarily apparent, and that the forms are indoctrinating minors by asking them their preferred names and pronouns, while parents are furious about this. According to the guidance, a patient should always be asked, "What pronouns would you like me to use you for, and how would you like to be addressed?" This is why the shit libs are just fucking have just made everything so fucked up. This is what I'm talking about. Excuse my language, but you know what I'm talking about. The questions were developed by the Society of Radiographers, who are pushing a national rollout, according to insiders. General practitioner Dr. Louis Ivana believes the guidelines are unnecessary given that it should be possible for medical records to accurately record sex. Exactly. She further stated, given that it is impossible for anyone of the male sex to become pregnant, there is no need to ask male people if they might be pregnant. It's all about the shitlibs and the LGBTQ community, just making it worse for everyone. It's just all about them. Like I said before, they just want to grasp for power and just want more and more and more of it. They are the they are the ones who are the most toxic. If someone identifies as transgender or non-binary and their records indicate they are biologically female, then they can be respectfully asked about the possibility of pregnancy. Why? How are they going to be? Why should you ask them about pregnancy for? The proposed radiography guidelines muddy the water by including the so-called intersex conditions. If they're going to be so offended of the fact that someone tries to tell them of the fact that you cannot have a baby because of your body, the way it's designed, because it's biologically not possible. And then the thing is, yeah, why the hell are you alive for? I don't want to say that, but the thing is, it's true. You can't, how your DNA is, how you're biologically made, you cannot change that no matter how much you try, no matter how much plastic surgery you do, you cannot change that. Fiona McCann, McEnon, sorry about that. The director of campaigns at human rights charity Sex Matters told the Telegraph, the Society of Radiographers inclusion policy is among the worst examples of professional bodies losing their senses by prioritising ideology ahead of biological fact. Exactly. I'll tell you something, man. Tell you something that the NHS is just getting worse and worse. The bosses who run the NHS, and I mean, they're pretty much just turning into a toilet at this point, putting healthcare staff and male patients through this humiliating farce with inclusivity, pregnancy forms, questions on the likelihood of pregnancy, and inquiries about their pronouns is both inappropriate and a shocking waste of time, she continued, going on to call for a retraction of new guidelines. The NHS trusts that have adopted this policy in their radiography units should immediately revoke it and return to common sense and reality. Well, the problem is they're not going to go to common sense and reality, because the thing is they don't want to be seen as they don't want to be looked as, oh, you're not being sensitive. It's like, no, it's about common sense. Common sense always wins, and they just want to live in a reality which does not exist. It just does not exist. Anyway, thanks for watching this video, and please like, comment, and subscribe on this video. And if you could follow me on X and subscribe on YouTube, Rumble, and Odyssey, TikTok, and BitChute as well, if you don't mind, please. Thanks for watching, and I'll see you soon.